Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.
Welcome to St. Louis on the Air. I'm Jonathan Ahl. April is National Donate Life Month. It's a great time to discuss the importance of registering as organ, eye, and tissue donors and to celebrate saved lives and also learn about some of the latest advancements in the organ transplant field. Joining me in the studio today are Diane Brockmeyer, President and CEO of Mid-America Transplant. Diane, thanks for being here.
Thanks for having us.
And Dr. Will Chapman, Chief of Transplant Surgery at Washington University and Barnes Jewish Hospital. Will, thanks for being here as well.
Thank you, Jonathan.
So, Dr. Chapman, thinking about organ donation and how quickly it changes and how far it's come over the life that we've been able to do that, where do things stand right now? Where are we in the history of organ transplant, and where does it stand?
Well, Jonathan, we've had great progress in the field of abdominal transplantation. I mean, it's interesting to me that in my lifetime, I remember as a kid when transplantation was thought to be experimental or didn't exist at all. And we've progressed to the stage where organ transplantation is now standard therapy. We are able to help thousands of people a year with organ transplantation, the majority of whom would not survive. So this is life-saving therapy, and the number of patients, the people we can help, has really increased dramatically. But with the advance, we've encountered other issues and other problems. And a big one is we don't have enough organs to help all the people on our transplant waiting lists. And so what this means is that we have people every year who die who could be saved with suitable organ donation. And, we've made great progress, great strides. We have more and more people who agree to be donors in Missouri. It's incredible the outpouring of support that we have from everyone. But we can do more. There are still more people who could agree to be donors. And that's really what we want to highlight. That's really what we want to be sure everyone is thinking about this and making that choice known.
Now, I read that in 2018 there were more than 36,000 organ transplants in the United States, which was the sixth consecutive year of an all-time high. So it seems like that every year more and more people benefit from this.
Yeah, I think that is definitely true. We have had increases in organ donation, I think, for a couple of reasons. One, everyone is considering this, signing up for donor registries. Families are realizing the great benefit. The other piece is we are working and learning ways to use organs that in the past maybe we wouldn't, or we would be concerned about how well they would function. So, we call that marginal donor organs, or they're less than perfect. But we're figuring out ways to use those organs so we're able to help more and more people.
Diane, your organization's website says that one organ, eye, and tissue donor can save and heal more than 75 lives. That's a lot.
It is a lot.
So can you maybe explain how is that possible for one donor to have that much effect?
I think the power in one donor and the recognition that it takes less than 2 minutes to sign up on the registry to save and enhance 75 lives is pretty remarkable. So there are 8 solid organs that can be transplanted: the heart, lungs, pancreas, liver, kidneys, and intestine. And then tissue, skin, eye, and cartilage donation can benefit far more than 50 to 60 people.
So of a donation, how many uh, how many are quality of life and how many are life saving?
Well, the 8 would be life saving. On the tissue side, I think that's probably a matter of perspective, Jonathan. A lot of the skin that we recover at Mid America goes for burn victims. So while that is used as a temporary dressing for burn patients, nonetheless, it's part of their journey in their life being saved as well. So many of the tissues that are donated, certainly not having vision and then being able to see after a cornea transplant, makes a tremendous difference. And we have folks come back that have never seen their children clearly, and to be able to see their faces very clearly is a pretty remarkable accomplishment.
Now, there's an issue with organ donation that I wrestled whether to bring it up or not, but it came up with a conversation that I had with a friend last night who said, "Oh, I don't want to sign up for that because you don't know whether they're really going to take care of you at the end of your life if they know that you're an organ donor." And I tried to tell my friend, it doesn't happen like that. That is just it is, but apparently this is still a perception that some people have. So what communication can we give people to alleviate that fear?
I think you're right. That's still one of the common myths that we try to deal with on a regular basis. But please, we want folks to rest assured that everything possible is done to save their life before the issue of organ or tissue donation is ever brought up. Only when they recognize that all those attempts have been futile and their opportunity to live is lost would the subject of organ and tissue donation be raised by their healthcare team.
Dr. Chapman, now I understand Washington University is part of a clinical trial aimed at making organ donation possible for people who are HIV positive. What does that project involve? And how much of it is happening right here in St. Louis?
Well, we are part of a multi-center trial that we've just activated where, 20 years ago, we weren't sure, or maybe 25 years ago, there was discussion about whether transplantation was even safe in patients with HIV. And the concern was when everyone who has an organ transplant goes on immunosuppression. And so the concern was that immunosuppression is going to set the HIV patient up for unusual and overwhelming complications. We didn't want to over-immunosuppress those patients. And what we've learned since then is those with organ failure and HIV can undergo transplantation safely. We have to modify the way the immunosuppression is used. There are some drug interactions that have to be accounted for. But the transplant part can be done safely, and we have been doing them at Barnes Jewish Hospital and as part of the WashU team. What this has changed and what our new trial is focused on is up until now, it has not been allowable and it has not been possible to use organs from HIV-positive donors at all. So those donors would not be considered. And what this trial allows for is use of HIV-positive donors in HIV-positive recipients when certain criteria are met. I mean, basically, the donor, the recipient has to already be listed, an HIV-positive recipient, and the donor is carefully screened. And when this is a matter of, we expect the HIV will be under control as it is already in the recipient today, this allows for donation. And this is, let me point out, includes live donation and deceased donation. Mm-hmm. So like for kidney transplant living donor. And this has already opened up possibilities for additional transplants that hasn't been able to occur otherwise in the past.
So medicine continues to try to break down those barriers to make sure that anybody who wants to donate can and anybody who needs to receive can. I know there's been similar things on people with hepatitis that can still donate organs.
So that's another big area.
Yeah.
We have been using donors with hepatitis C and some components of hepatitis B as a regular part of transplantation, and we've been doing that for a number of years. But we're even expanding that use. So now we even consider hepatitis C positive donors for patients who may not have hepatitis C, but we can treat and cure that hepatitis C in the recipient. So yes, these are all strategies to increase donor availability, especially for those who need it.
Let's take a call. Bobby in Brentwood is on the line and has something to say about this. Bobby, welcome to St. Louis on the Air.
Thank you. I'm an organ donor, but I noticed that your speaker is discussing tissue and eye donation, and there is no place on the driver's license to indicate that. So how do I donate those things or let anyone know that I want to?
Diane, can you field that?
Yes, I think, Bobby, thanks for your call. I think the biggest thing you can do is, one, ensure that your family knows what your wishes are. That's always still an important conversation to have. And secondarily, on the back of your driver's license, you could just make a note that says all organs and tissues. The assumption that we make when we talk to families about their loved ones that have signed up on the registry is the consent is for everything that can be used for transplant. So we treat it as a global consent, even though the license doesn't specifically break out organs versus corneas versus tissue.
Bobby, thanks for your call. Another similar one, Diane, maybe you can field this. Madonna, one of our listeners in Crestwood, sent us an email that says, every holiday, Father's Day, Mother's Day, Christmas, etc., we all get out our driver's licenses and pass them around to sign witness to each other's organ transplant designation. Madonna has a question. How legal and or effective is that designation on the back of your driver's license?
In the state of Missouri, Illinois, and Arkansas, the areas that we work in, that license is considered a legally binding document. So we could pursue donation, and what we would say to your family, Madonna, is that Madonna's made her wishes known. We are here to help you facilitate that process and make sure that the gifts she wanted to give to save lives, that comes forward for her in the next few hours.
We need to take a quick break. We'll be back in just a moment to continue our discussion in light of National Donate Life Month. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
Now back to our discussion with Dr. Will Chapman of Washington University and Barnes Jewish Hospital and Diane Brockmeyer of Mid-America Transplant. I'd like to talk about, because you've mentioned it briefly in passing, there's two ways to donate organs and tissues. Living, where someone can give something and still maintain a completely active and normal life, and then maybe the more unfortunate one when you've passed away. So what are the differences between those two, and maybe help people understand which organs and tissues we're talking about in both of those cases?
Sure, Jonathan. This has been done, meaning a living person to another individual for a number of organs, but some in just a very limited way. Let's take the major involvement today. Kidney donation is very commonly done as with live donors. So living donors now in some programs may make up to 40% or even as high as 50% of the number of transplants that occur at a center. So, at Washington University, we'll have in the range of 75 or 80 living donors a year. The total number of people transplanted for kidney is about 250. So that gives you a little bit of the perspective. Now that just a few basic components. This is a very safe process. We don't consider this if there's any jeopardy to the donor. So the donor's got to have very good health. And careful screening is performed, but when that's done, the donors have normal lifespan. They really take very little risk, but they do go through an operation. This is a major undertaking, and so it has to be carefully thought about. Now,
so the Hippocratic Oath still exists here. First, do no harm.
Absolutely.
Even in these cases.
And we're really stringent about who we consider for donors. Mm-hmm. But, we have people today who know they are in good health and want to help someone else. And actually, we have donors that make that altruistic gift without even a person in mind, who will give a kidney to somebody on our transplant list who otherwise would wait maybe years to have a transplant. So kidney, that's the biggest area. We do consider this is considered for liver, but to a much smaller percentage.
Mm-hmm.
And those are really the only two areas currently thought about today for living donation. The remainder are from deceased donors, and this is the importance of letting your family know, signing up on the registry, signing your driver's license.
Diane, what percentage of people would need to be registered as an organ donor and be willing to do it for us to be able to meet the need?
I'm not sure we could ever accomplish that.
Okay.
I think as the list for transplant continues to grow with the innovation in medicine, despite great efforts to get more and more people to sign up, despite great efforts to get more and more people to authorize donation if they're not on the registry, it feels like many cases, Jonathan, we're kind of chasing that number. I think the goal is every family that tells us when they come back they're so thankful to be a part of leaving a legacy and making a difference to the loved ones that they're benefiting on behalf perhaps for other families. But I think the biggest piece is we continue to drive that number and push that number, but recognize that with 1,200 folks waiting here in St. Louis for a transplant, it will be a challenge for us to continue to get more and more people, all of them transplanted.
When you say 1,200 people, is that St. Louis area,
It's the St. Louis Transplant Centers. Yes.
Okay.
Mhm.
Okay. And now, my understanding that nationwide, 22 people die every day who are just waiting for some kind of
Correct.
transplant. And where are we? I mean, we talked a little bit earlier about a misconception with donations. What are the other barriers that because it just sounds like that many people die every day, and a lot of their organs could be used. What are the barriers really to keeping people from signing up?
Well, I think there's sometimes the general fear that you mentioned. Has everything been done to keep my loved one alive? Does my religion support it? And the answer is yes. All major religions support organ and tissue donation. Can I still have an open casket funeral is a question a lot of
Really?
families raise, right?
Okay.
And so your funeral arrangements can continue as they should be, as you want them to be. So a lot of those misconceptions, the basic kind of mistrust issues about, the care that they receive, we continue to try to educate and inform and work with families, both as they're making the decision to sign up, that they feel comfortable with that, but also when they're in the hospital scenario.
I'd just like to throw in, as a point of personal privilege, I'm signed up, and I told my wife knows, and my parents know, and anyone who would ever be in a position to get that phone call that nobody wants to get, or get that visit from a doctor that nobody wants to get, they know, take it all. I mean, Woody Allen said, I don't want to reach immortality through my work. I want to reach immortality through not dying. But the second best thing might be to have to help other people live on.
To save the life of another. What a remarkable legacy.
Well, we hear a lot about organ rejection. How is that? How are the advancements coming on that? Is that something where it's much less of an issue than it was in the past?
Well, we've made great progress in making long-term success of transplantation a reality. And so the immunosuppression strategies are very effective. There is some variability on the risk of rejection. So, for example, in liver transplantation, rejection is rarely a problem that we can't control easily. It's a little more of a problem in the other organs, kidney, lung, and heart.
Mm-hmm.
But it's able to be managed. And the other thing is the side effects of our current immunosuppression are pretty limited. So we expect by just a couple of months after major transplant that patients are back to full activities. We do not put restrictions on what patients do. They are going to be committed to, at least a majority, to long-term immunosuppression. So you've got to take your medication. But for the most part, rejection is not a major issue. And I would point out that one of the things that we're currently working on is the ability to get patients in the future, not done today, but at some point, potentially on either very low dose or in some rare cases, no immunosuppression. So, that's hopefully coming in the future.
Throughout the course of your career, what's happening right now that if someone had told you it was going to happen when you were early in your career, you just wouldn't have believed them in terms of organ donation and transplants?
Yeah, I think, like I said, when I was a kid, I remember distinctly. My father was a physician. He was an anesthesiologist, and the discussion of the day was liver transplantation is an impossibility. This is pie in the sky. And let me tell you, in this liver transplantation, after the first attempts in the late 60s, there was a moratorium on liver transplantation because it was thought to not be possible. So, in my career as a surgeon, it's gone from I would say almost tour de force, very long, major operations, depleting the blood bank, to one that's very streamlined. Our patients stay in the hospital a week or less for the most part, and some as early as 3 days. It's a really streamlined procedure and that's true for all solid organ transplant today.
What do you think we're talking about right now that we say is impossible, that 20 years from now when someone's listening to St. Louis on the Air and listening to the program on organ donation 20 years from now, they'll say, could you believe that 20 years ago we said blank was impossible and now we're doing it?
Yeah, I think, to tell you the truth, we're not going to have organ transplantation at some point in the future. We are not from one human to another. We are going to figure out a way to have alternative organ system support. That's what this is, really.
Artificial growing
growing.
Yeah.
To be able to satisfy the needs we have and not have to do this process. But that's a long ways off still.
Well, I mean, like a 3D printer for organs? Is that
3D printer where you populate the scaffolding, you make a scaffolding, you populate it with a cell matrix that performs the functions of the liver, for example. There's work being done in this in kidney. We have mechanical support devices that are improving every year for heart function. And so these technologies one day we'll be able to meet the needs. We're not going to have 20% of our patients dying on a waiting list. We're going to be able to do something for everyone.
But until we get to Jetson's flying cars future,
yes.
Diane, people need to do something now. And we have an email from Adam. He writes, I am signed up for both organ donation and whole body donation. I was told that if you choose whole body donation, that organs are not used for transplants. Is that accurate?
That's accurate.
Okay.
So if you make a whole body donation to one of the medical schools, for example, they really want to have the whole body for the purpose of science and study. So we can't do organ donation. So we would say to Adam, be an organ donor, leave the legacy for the folks that can benefit from and save the lives of those that can benefit from the organs that are suitable for transplant.
Diane, let's say that someone is inspired today. They've heard our conversation and they are convinced that now is the time to sign up. Exactly what do they do and what do they need to do to become a possible organ donor in the future?
It takes less than 2 minutes, Jonathan. The national website is registerme.org. You can go on, you can enter your information, and in less than 2 minutes, your information is available to any organ procurement organization across the nation. You can also make that decision the next time you go in the license office, or you can go on to the Missouri DMV site and indicate that to be on the Missouri registry.
And talk to your family.
Because
if you sign up, but your family says no,
we don't proceed.
I want to point out how good our talk show team is. For the record, the Jetsons takes place in 2062. So actually that timeline might work well that we have that. Thank you so much, Diane Brackmeyer with Mid-America Transplant and Dr. Will Chapman of Washington University and Barnes Jewish Hospital for being with us today. It's been a pleasure. I really appreciate your time this afternoon. This is St. Louis on the Air, St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.